Good evening. This is Diane Hudson, and this is my discussion for Module 5. Um, the topic that I chose to discuss tonight from the chapters that have been previously read was from Chapter 7, and that is Informed Consent. I chose this because I was kind of interested in that, and I'll discuss that a little later when I get to it. But with the informed consent, I can kind of relate to with the minors that were in the legal system because I adopted my niece's 3 children. And when I took them to the doctor, I had to show proof of who I was, the adoption papers. And even today, when we go somewhere for the first time, if they're getting medical care and it's not in the system, even though the baby girl is a senior, I have to show where I have consent or I have guardianship or I am responsible for her to give consent for any treatment that she receives. And just as simple as when you go to the doctor's office and you have to sign the papers giving them consent to do whatever they're going to do when they see you. And I was very interested in the fact that before they do a procedure or a surgery, how they have to explain, they being the medical facility or person that's waiting on you or that's seeing you, how they have to explain to you what the surgery is about, what the surgery would do. And I noticed that my sister recently went into the hospital with pneumonia, and they were just very, very detailed about what was going to take place and how they were going to treat her. And so then when I read it in the chapter, I said, oh, okay, no wonder they're being so entailed. The other thing interested to me was when they talked about people with medical issues that are not responsible for being able to give consent. Now, my concern stops right there, and that's why I chose this particular topic, because I have 2 people that I know that have grown sons, and when I say grown, I mean in their mid to late 20s, who both are schizophrenic. And these parents are going through some stuff with these young men because they have episodes, and a lot of times they don't want to take their medication, and when they have these episodes, the parents have to deal with the outcome of it. And so I have asked both of them, well, being their legal guardian, why come you can't just sign them into an institution or something? And they both said that because their children, their sons were of age, that they had to give consent to let the parent be their guardian. So I don't know if that falls into another arena where they would have to go do this legally, but how can you do it legally if that child is considered of age, but you know they're diagnosed as schizophrenic? So how can they then be in their right mind to say that I don't want my parents to have guardianship over me? That's just very confusing to me, and maybe you can help with that because it's just, I don't understand it, because it seems like in the book that it was saying that people who are mentally incompetent judged by the court to be insane. So is it that people with schizophrenia are not considered insane? I don't know, just a little confused. But yeah, this consent form or informed consent was kind of interesting to me because of that situation. If it were just one person, that would be different, but 2 people that are having issues and they're just having to deal with it because these sons are refusing to get service. They're refusing to give their parents consent to be over them, but yet they're not in their right minds. And so that just really puzzles me, and it just really doesn't make sense to me. And then the other thing was with the HIV patients and the husband and wife thing, where if the wife get an abortion, she has to get consent from her husband. That was surprising to me. And one thing that I did not know about until I read this chapter was the Good Samaritan. I mean, you hear about people being good Samaritans and stuff, but a person that works in the medical field, if they stop and render services or help a person, it has to be quote unquote and act as a good Samaritan. Now, if they try to bill that person, then they can be responsible if something go wrong, and that person should try to sue them, and I can understand that being in place. So I just feel that this particular chapter, or this particular portion of chapter 7, was a very interesting chapter because it kind of hit home on some things for me. And informed consent is so important. And like the book was saying, when there are cases where a person will go into the emergency room and they cannot give consent, then that the doctors or the persons treating them will act on their best concern, or what's best for them, and that is to save their life. So this concludes my discussion on informed consent. Thank you, and you have a good evening.